All right, we still have a few people joining us. So should we start?
Yes, that'd be great. We'll take a look at the slides here.
Okay.
Thanks, Jessica.
Sure. Here. I need to continue admitting people. We are up to
Perfect.
92.
That's fantastic.
92
Thank you.
meetings, I think. They're all joining right now. Hopefully I can still admit people while I am sharing my slides. So we will see how that goes.
Okay. Thank you so much. Very good. Thank you, Jessica. And there we are. Thank you, everyone, for joining us today. My name is Joe Bergeron. I use he, him pronouns. I'm the rate setting policy lead. So I work full-time on this project, our temporary healthcare staff rate setting program. Welcome to the information session for the February data request to temporary staff agencies and facilities. We look forward to using this time to share a brief overview of House Bill 2665, discuss the purpose of the data request, and answer any open questions you may have about sharing and submitting data. Our goal is to review the data requests sent to temporary staff agencies and facilities and discuss how to submit the request and what type of data to share with OHA. While we provide context on the request and House Bill 2665, we're not going to review all of the different bill features at this time. If there are questions outside of the data request specifically, please reference our website. I'm going to put that here in the chat. There we go. And you may also contact me here at our shared mailbox, which I have also put in the chat. I monitor that each day. You can contact me with questions about the bill there. We're also revising our website that you see there, and we'll be adding, that's where the recording of today's session will be. We're assuming we get that all updated by the end of the week. We'll be taking notes throughout this meeting, and we'll share any frequently asked questions with attendees and those that received the data request. We'll leave questions for the second portion of the meeting and ask that you use the raise hand feature at that time. You're also encouraged to use the meeting chat throughout today's call. This will be monitored by our team throughout the next 50 minutes. And Jessica, next slide, please.
One moment.
Sure thing. Here is our agenda, which I discussed briefly in my remarks just now. Next slide. And now just a brief project overview here. Next slide. Some background on House Bill 2665. During the 2023 Oregon legislative session, House Bill 2665 was passed by the Oregon legislature in response to healthcare system strain during the COVID pandemic, with staffing shortages and significant increases in costs for temporary staffing. The bill directs OHA to adopt rules that set maximum rates for specific providers. And those providers or personnel, as it is termed in the bill, are generally related to nursing. It's 5 categories of personnel specifically: registered nurse, licensed practical nurse, certified medical assistant, certified nursing assistant, and direct caregivers. Individuals in these 5 personnel categories who are employed by temporary staffing agencies operating in Oregon hospitals, long-term care facilities, and other specific facilities identified in the legislation. In response to House Bill 2665, OHA's begun pre-implementation steps to work toward the operative date of January 1st, 2025. That's when this new law will take effect. Next slide. And now I will pass this over to Lizzie for some background on the data request.
Great. Thanks, Joe. So my name is Lizzie Zagami, and I am joined by Steph Dorish. We are supporting HB 2665 implementation, and we'll be walking through the remainder of the deck as well as the Excel file. So we can go ahead and jump to the next slide. Okay, so just the purpose of this request, as the maximum rates are developed, there are various data points that OHA is collecting to use as inputs and benchmarks to set a comprehensive maximum rate. A data request template has been provided, which we'll cover in more detail shortly. And there are some minor differences between the template provided to the temporary staffing agencies and the facilities, which we will highlight. Most of the information is going to be consistent across those 2 templates, just some minor differences due to the different nature of the facilities versus the agencies. So what type of data are we collecting? The data request includes salaries for the positions outlined in 2665, both for temporary staff wages and rates, and permanent staff salaries, that's specifically for the facilities. Additional costs for benefits are also requested. Specifically for the temporary staffing agencies, salaries for administrative staff supporting the agencies, as well as any additional costs, are requested as well. This information will be used to support the comprehensive max rate for reimbursement. The intention behind this data request is to support setting a sustainable rate for both temporary staff while encouraging local healthcare workers to remain in Oregon. And this is to ensure there is sufficient access to care across the entire state. This information will be used in conjunction with information that we're gathering through an environmental scan and review of national research to develop the maximum rates. Go ahead and jump to the next slide. So just highlighting that this data request is open until March 11th with extension possibilities. If you do need an extension, we ask that you please contact the HB 2665 email with any requests, and we'll acknowledge those via email. Starting off with just the partners engaged, we want to highlight here that we have engaged the temporary staffing agencies and the hospitals and facilities. You'll see there's a wide range of attendees on this call, so we thank you all for being here. And we have also engaged some of the trade associations. That is for awareness only, but we have sent out some notes to them as well. The format for this data request is an Excel-based survey. That is the template that has been shared. However, if there is available data in other formats, we will accept any format that is available. We have the informational session, which you guys are all attending today. So thanks again for being here. And then the third thing on here is the follow-up meetings as needed. Based on the data collected, if there's anything we want to dig into a little bit more, we may schedule some follow-up meetings. If there are meetings that we want to review any of the data that is outside of the templates, you may receive follow-up emails from us to schedule some time. We are going to continue today's conversation focused on the template and walking through the types of data that we're requesting and addressing any technical questions you may have about the submission. So for that, I'm going to go ahead and pass it to Steph, and we will pull up one of the templates to share.
Thank you, Lizzie. I will share screen here, Jessica.
All right, one moment.
No worries. All right. Let me know, Jessica, when you can see my screen, please.
I can see your screen.
Are you seeing the data request PDF?
I am.
Awesome, thank you. So as mentioned, I will be presenting an overview and instructions on the HB 2665 rate setting data request sent to the facilities as well as the temporary staff agencies operating in Oregon. So as I go through this section, please feel free to use the raise hand feature, and others on the team as well as myself will be monitoring so that we can answer any specific Excel-based questions or questions on the template as we go. We'll also continue monitoring the chat. I haven't seen anything yet, so please feel free to ask your questions that way as well, or send in the email that Joe referenced. So first I have pulled up the instructions that were sent along with the Excel data request. I wanted to point out that here in the instructions, it's emphasized that entities are not required by law to provide information to OHA. Entities also may choose to submit data in a different way, such as a raw data or a narrative. So while we will be guiding through the template today, it is completely acceptable to send over your data in any other format that may be available. Lastly, I want to point out that the data request will be confidential unless compelled by law to disclose. So please refrain from sending any PHI or PII and mark all documents as confidential to the best of your ability, and we will keep them confidential on our end as well. I will now transition to the Excel file. All right, so I want to first preface that there are two separate data requests sent, one for hospitals and facilities and one for temporary staff agencies. The information meant to be gathered in each of these is the same. However, two requests were created in order to capture some of the slight nuances in the data itself. So I will be discussing the hospitals and facilities data request. That is what you are seeing on my screen. But it is very similar to the data request sent to the temporary staff agencies. The first tab is an overview tab. This is very similar to the instructions PDF that I just showed and provides some background on the data request as well as those confidentiality statements that I discussed. The second tab is an attestation tab. We ask that you complete this to attest that you understand the data request is not required by law and that you agree to the data being confidential unless OHA is compelled by law. So in row 3, you can fill out the name of your organization the name of the representative. In row 5, the name of the organization, and row 7, the date in which you've completed the data request. All right, the next tab is hospital information on the hospitals and facilities request and agency information on the temporary staff agency request. This tab is to provide background on your hospital, facility, or agency. So to the best of your ability, please complete the pale yellow cells. In places where there are white boxes, these are meant to be checked by clicking on the box if that area applies to you. For example, in question 3, we are asking which geographic locations in Oregon are most closely aligned to your organization. If you operate in Portland, you would select the box next to Portland Metro. And if you also operate in Southwest Oregon, for example, you would select that box as well. And then in column C, in the cells related to those rows, if you could please list the percent in which you operate in those regions or the number of healthcare staff in each of those regions. Either would be acceptable. As mentioned in the instructions, none of this data is required, so please fill out the template to the best of your ability, and feel free to leave any blank questions that do not pertain to your organization. I'm seeing some questions come through. Lizzie or Bree, are there any to address at this point, or shall I keep going?
Yeah, I'll jump in real quick. I think a few of them are pretty similar. So this, again, we're going to emphasize is completely optional, even just the question. So if you want to just submit some data, we would accept anything. So everything is optional. It's not mandatory. And then as far as the last question, I'm sorry, I'm just reading it. So we did collect emails from as many providers and temporary staffing agencies as we could. However, if there are additional contacts that you may know of, please feel free to forward this to them. If you'd like to send us their emails, we will share the data request with them as well. So it is open to any agency. However, the data collection or the contact information collection was as broad as possible as we could get.
And Lizzie, I'll just jump in and I'm going to drop this in the chat too. But just if you could send your name, your organization to the House Bill 2665 implementation email, I'll drop this in the chat. We'll make sure you get the data request.
Thank you, Bree and Lizzie. I'm not seeing any hands raised at the moment. Is that correct?
Yep, you're good.
Awesome, thank you. All right, so the remaining tabs in the data request are for compensation related to permanent staff and temporary staff. On the temporary staff agency data request, there is only a tab for the temporary staff. So on this tab, it is very similar to fill out the pale yellow cells. The primary purpose of these compensation tabs is to collect information on the wages being paid to both permanent healthcare staff and temporary healthcare staff. So there are columns for each of the positions that are highlighted in the bill. And there are also extra columns for positions that you may have in your facility or agency related to healthcare that you may believe would be incorporated in the bill or in the maximum rates. And what we're asking for there is to please provide the same level of data for those positions and then specify which positions you are referring to in those columns in your email when you are submitting the data request. In addition to the data provided on these tabs, we are also requesting that any supplemental information is included one of two ways. One is by clicking this plus for a new sheet on your Excel and incorporating any data or tables that you may have there, or by sending any supplemental files in the email along with your completed data request. Again, if you scroll down, you will see additional places where the white check boxes are incorporated and the pale yellow cells for more detail. And in the top two rows here, I have just placed a brief example of how one may fill this out. So for this hospital facility, for permanent staff, there would be 60% of their healthcare workers are full-time and 40% are part-time. They have 3 registered nurses. The average wage for those 3 is $45 an hour. the minimum, and these are flopped, apologies, the minimum would be 40 and the maximum would be 50. So to complete this data request, I would fill out a very similar style for the other positions, aggregate annual salaries and wages, and then any shift differential payments that may occur between holidays, on call, overnight, weekend, or other. If there are any pieces in your data that you feel need to be clarified and this template is not sufficient to the level of detail, again, please either use a supplementary tab or provide that additional detail in email form. All right, I will pause there. Lizzie, Bree, any questions to answer live or anything that I missed walking through the data request?
So there's a question about the contract fee in the temporary staff or the staff agency sheet. Additional information on what that is.
I'm just looking for that one. Here. Yeah, so this row is really meant to capture anything that the temporary staffing agency may build into their overall rates related to contracting with the facilities. So this is one of those places where if it doesn't apply, definitely feel free to leave blank. And if it should be considered in a different way, please let us know that type of feedback in an email.
And then addressing just a few of the other questions, sorry, just taking a look. At this time, we haven't discussed sharing the data publicly, so that's something that we will take back as well. And we are also going to take back the question on the list of agencies that have been sent this request. So if you'd like to send those questions via email formally, we can address those after this call. Otherwise, we'll take note of those and take them back.
I do see a question as well asking if temporary staff should be nationwide or for those placed in Oregon. Correct me if I'm wrong, Lizzie, I believe that we are looking solely for the Oregon information. So if you can provide the compensation for temporary staff for Oregon specifically, that would be great. For salaries and wages, yes, gross per week works. Again, if we are accepting data in any format that is easiest and most accessible to you all. If you do provide it in the gross per week form, we would just ask that you clarify that either in a supplemental tab or on the email provided. We intentionally left the data request vague to try to allow for as many organizations to complete it as possible and understand that there will be nuances in how it is filled out. All right, we have plenty of time remaining for additional questions. So I think we can just wait a few minutes here to see if anyone raises their hand or puts additional questions in the chat. Yes, the data can be emailed. If you would be able to save your Excel file that is completed and email it back to the HB2665 email shared in the chat, that would be great. As of now, this is a one-time data request, and we will follow up in future communications if the request will be repeated. Christopher, the templates should have been sent via email. If you did not receive the template, please let us know and we will make sure to email that to you so that you have it. And for nursing, yes, it is currently for the 5 positions outlined in the HB 2665 bill, which are the 5 listed here: registered nurse, licensed practical nurse, certified nursing assistant, certified medical assistant, and direct caregiver. Bob, that is great information on call time not generally being a multiplier of salary. If you could provide an expanded spreadsheet, that would be very helpful and much appreciated. Trying to keep up with the chat here. Amber, we will send the request to you. Yes. For the current year or past year for data, we have specified to include 2023 data if available. If using any other data, please feel free to specify. So direct caregiver, Bob, is not directly defined in the bill. We can send out a follow-up on the more defined position for direct caregiver. For now, I would say if you are able to submit a data request with a position that is closest to direct caregiver from your experience, and just qualify that in the email, we can follow up if additional data is necessary. And for calendar year versus fiscal year, I believe we've been referencing calendar year. Lizzie, correct me if I'm wrong.
Yep, calendar year. But if that is not available, knowing that we're in March 2024, feel free to just let us know if it's fiscal year in the email. I can go on the profit margin. We would prefer that to be specific to the state of Oregon, but if it is only available at an organizational level, that's also acceptable.
I do want to chime in as well regarding the ask for average minimum and maximum hourly wage. If it is available and easily shareable to provide the wages for specific contracts that is at a more granular level, we would greatly accept that and can calculate the minimum, average, and maximum ourselves. So just going back to the point of any data that is available, please feel free to send. And the more detail we have, the better for the analysis.
So looking at the last question in the chat, if you still have a license pending, we would still want to collect that data any data that you have available as well. So this can be for those who are licensed or those who are pending license.
Great questions. Thank you all. We'll wait a few more minutes to see if more trickle in. While
I think we've been following them all. So if anyone we missed, just feel free to copy and paste it one more time in there.
I was just going to add just a reminder that the deadline for this data request is this coming Monday, March 11th. And to reiterate, if an extension is needed, please feel free to reach out to us. Yep, Anytime Monday works great, Christopher. This recorded training will be available on the website that was sent in the beginning of the chat. Bree, maybe we can pop that in one more time.
Yep, sending now.
Yes, the data is completely voluntary, absolutely. And Autumn, direct caregiver, the definition was not defined in the bill. So we will send out a follow-up with more clarity on direct caregiver. My ask for now is if there are positions similar to a direct caregiver, please provide the data for that and qualify what the title of that position is. And Cassie, I saw a similar question. They're great questions. Thank you all for being participatory. Just going through to see if anything else comes to mind in the data request. Joe, is there anything that you would like to add?
The only thing I would add is that we were hoping to have our website a little bit more updated by today, and so that's just delayed, I guess is my only comment. And so hopefully by the end of the week, as I mentioned before, we are intending to put the video recording of today's session onto the website, so it's accessible there. It's just the timing is unclear. I'm not sure if that'll be available by the end of this week or early next week. But the long-term plan is to have updates about House Bill 2665 regularly added to the website over the coming months.
Thank you for that, Joe. Very helpful.
Sure.
And yes, I will reiterate Lizzie's response that submission of any data is completely voluntary for all participants.
Do I need to share my screen again?
Nope, I don't think so, Jessica. I just stopped sharing my screen to allow for more questions to come in. So we can just hold off for more questions, but I don't think any more screen sharing. And Ed, to your question, all size firms, to reiterate what Lizzie said in the chat, we are collecting from all firms. And to go a step further, we are looking for a diversity of firm sizes. So the participation of small and large will be helpful. Yes, we'll happily send our data requests to additional contacts. Absolutely.
So I do want to just chime in on the direct caregiver. So this would be, we are not leaning towards this as doctors or NPs. This would be In our initial read, more on the long-term care side, the direct caregivers is supporting with activities of daily living and leaning more towards that. However, it still needs to be fully defined. So looking more on, I wouldn't necessarily say it's going to be completely the uncertified personnel, but it will be, it would not be the physicians.
Yes, Christopher, the data request is only voluntary and not required. Kristen, I see a hand raised.
Hi, thank you. I apologize. I was just able to join this call, and so I'm not sure if I missed kind of the structure of this meeting. So I apologize if my question's kind of just out there. But the spreadsheet that I received, the tabs specifically say for hospitals. And I saw the one that you were just sharing had a different verbiage. And I'm sorry, it was going off the screen as soon as I pulled up. And so I have not been sharing that quite yet because none of the community-based care settings that I work with would ever identify themselves as a hospital. So they would immediately see that and think it's not for them.
Great. Yeah, thank you for that clarification, Kristen. I just popped my screen back up. Are you able to see the Excel file?
I cannot see anything being shared right now.
Oh, maybe Are you
There
able
it
to
is.
see it now? Perfect.
Yes, thank you.
Thank you. Kristen, that is a great call out. So in the hospitals and facilities data request, unfortunately, the tab is titled hospital information. It is meant for facilities as well. So if you would like, Kristen, I know, for your facilities, we could definitely send a second version with that tab renamed, if that'd be helpful.
I do think that would be helpful, especially right now where community-based care in particular, there's like 4 other surveys that are going on right now. And so I think if they saw this, they'd be like, oh, I don't have to do this one, and wouldn't even like dig into it once they saw that it was meant for hospitals. And they would think that unless they were like a skilled nursing facility or which also isn't a hospital, but I think we're going to lose community-based care here with this verbiage.
Thank you for that feedback, Kristen. We will create a facilities one and send it to your email. Thank you so much.
Thank you. Really appreciate it.
And I see Brandy echoing your point there, Kristen, so appreciate that feedback. I do want to add as well, Brandy and Kristen and anyone else that this may apply to, if your facilities have other data requests that are collecting similar information and they're already going through this process, again, we will accept the data in any format. So want to make it as easy on our partners as possible. So let us know if there's other formats or feel free to have the facilities send it over in that way.
For those of you who have just joined us, we have just concluded the main part of our presentation, and we are now in a question and answer session.
Thank you, Jessica. And to add to that point, the session has been recorded and it will be posted to the website. So if you missed the beginning, please feel free to access that recording to hear the primary content of this meeting.
And I think, Steph, once the video recording becomes available in the next couple of days, I think we had planned to send that out via email.
Awesome.
As that might be quicker, seeing as the turnaround on getting the website updated is a little bit longer.
Great. Thank you, Joe.
Yeah. So once we get that on the, it'll be at a YouTube format on the OHA's YouTube page, then we'll send that out via email.
Great. Well, at this time, it looks like the chat has slowed down and I'm not seeing any hands raised. And our participant list has slowly been shrinking. So Joe, I think I'll pass it to you to close us out.
Thank you very much. And thank you everyone for your time today. And look forward to receiving your questions. I can see in our shared mailbox that several of you emailed during the meeting. So we'll be following up on those questions in the coming day. And thank you very much for your time.
Thank you, Joe. Bye all.
Goodbye, everyone. I will be closing the meeting.